Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you.
Welcome back to Between Two White Coats. Amber and I would like to talk to you today about a very common symptom and sometimes a very frustrating symptom. Frustrating for the patient, but frustrating for the medical provider as well. We'd like to talk about being tired or fatigued.
It's one of the number one complaints.
It's one of the number one complaints.
I'm tired.
And what could it be? What couldn't it be? So it is hard when someone walks in and you're already behind and they're like, I'm so tired. And you're like, okay, that is super important. And I'm glad you're here, but that's
could literally be anything.
Could
or
literally
nothing.
be or nothing, or just make some lifestyle change. So the first thing I will do when someone says I'm tired, I'm fatigued, is I try to medically distinguish between fatigue and sleepiness. Because either could be described as tired.
Yeah.
And so I will ask people, are you more fatigued or are you more tired or sleepy? And the way that I distinguish that is if you get up and start doing stuff and you get stimulated, then do you tend to wake up and feel better? And if so, that might be more sleepiness.
Which can also be its own realm of
absolutely
diagnosis.
Kind of puts me on a path of, am I looking more at a sleep disorder, obstructive sleep apnea, poor quality sleep, or could there be more other illness that's leading to fatigue? So or I will ask, if you sit down and you sit for long enough, do you fall asleep? If you are still for a period of time, do you tend to want to fall asleep? You're driving home, you feel so sleepy, your eyes are heavy, you want to fall asleep. So first, I really feel like distinguishing between sleepiness, which then makes me want to go down well, let's talk about your sleep. Do you have insomnia? Might you have obstructive sleep apnea? Are you not getting restorative sleep even though you're asleep for a while? Now we're talking more about sleep-related issues if you're actually sleepy. Or if you get up to do stuff and it doesn't exhilarate you, it doesn't wake you up, but instead you start to do things and you can't. You feel short of breath, or you have to sit down and rest. Your get up and go is not there. Then I'm looking more at this is probably fatigue. And now what are we going to do to work up the fatigue? First of all, if you are at home and you are feeling either sleepy or fatigued, it's worth a doctor's visit. A lot of people will explain this away.
And it tends to be progressive, right? Like you don't just wake up one day and then you're just, oh my gosh, I'm exhausted. I can't do
I feel like I've been
used
hit
to.
by a truck. You'll get to the doctor.
Yeah. But it's like this slow progression of, am I sleepy? Am I fatigued?
I had a good day today. I might be better. Oh, I had a bad day. Maybe there's something wrong. So it's really hard to know. And then we explain it away because we all have a reason to be tired. Oh, I didn't sleep great last night. I'm running on empty. I missed lunch today because I was working so hard that they didn't give me a lunch. And I just don't feel good. I'm just tired. I'm too busy.
Yeah.
And in our American lifestyle, almost everyone is too busy and they feel like they're running on empty. But you can ask yourself, well, was I too busy 6 months ago and felt better? And now it's starting to creep into my life a little bit more. Well, then it's probably not just a result of being busy. And you might need to pull back and get some rest and try a couple things. And if in a few days you're not feeling better, then you need to talk to someone.
Yeah.
And whether it's sleepy or whether it's fatigue, either way, a doctor's evaluation and workup is an appropriate thing.
Yeah.
Fatigue can be some simple stuff. It can be lifestyle related, nutritional. It could be that you're hypoglycemic, you're skipping meals,
I see
your
that a
sugar
ton.
drops. Yeah.
I actually see that probably more often.
Intermittent fasting is a popular thing. It doesn't work for everyone.
Yeah.
People will feel really fatigued out when they're running on empty. They don't have fuel. They haven't eaten. They're doing that. I don't eat for 12 hours. And then they try to exercise or something and their body just doesn't have the fuel.
And I've used because I've seen so much of it, is the continuous glucose monitors. Like I'll have patients, I'm like, you don't necessarily have to have diabetes.
Cash for one of those. They're not terribly expensive.
And so to wear that, and I have patients that often will come back and be like, I wasn't eating enough, or I was going hypoglycemic half the day.
Every time I felt bad, my sugar was 50, 60. And we're like, oh, well, that's helpful.
The answer.
Yeah. So that's a nice little diagnostic trial is slap one of those continuous blood glucose monitors on. And anytime you're not feeling your best, see is there a correlation with your sugar levels. One of the things that people frequently come in thinking they have, whether they have or not, it ends up, being a simple lab, is thyroid issues. Yeah. And people will certainly be fatigued or tired if their thyroid is either too high or too low. And so I think one of the early workups that we'll do for someone with fatigue is some simple blood work.
Yeah. And iron deficiency, and like we also do, we tend to do it here. I'm not sure how everyone's primary care does, but like we'll do vitamins and we'll do iron and more than just a hemoglobin just to see. And I found patients that their ferritin would be low. And so we, replace that and they feel so much better.
Ferritin is the precursor for iron. And sometimes first you have ferritin, then ferritin becomes iron. Iron is used to build red blood cells. And so first we go, well, you don't have anemia. If all we did was get a CBC, then you could be on the early stages of stuff, but you're not anemic yet. And it could also, if it's really early, your iron level might still be okay, but your ferritin has already dropped. So downstream, you're going to start having low iron. So those are really great ways to be proactive, is get a ferritin, get an iron and TIBC, get a CBC, and that will really evaluate for iron deficiencies and anemias. Especially women in their reproductive years, when they're menstruating, they will often lose more blood than they can rebuild, and they'll have anemia. Yeah. And that will certainly make people not only, I think fatigue is one of the early symptoms of that. You can get shortness of breath with exercise because you can't carry enough oxygen. You end up feeling really washed out. Some people might say you look pale because you don't have enough red blood cells to kind of give that pink to your skin. Yeah. If you look at the pink of your eyes, when you kind of move your eyelid a little bit, that pink will be really pale. Those are all indications of anemia. And so anemia workup is always going to be part of a fatigue workup. A thyroid, how aggressive people go with thyroid labs will probably depend on your other symptoms. If there are other things like my hair is falling out and I'm constipated, and if I'm a woman, I'm having abnormal periods, any combination of those things can point to thyroid as well. So then we might be more inclined to do more of a thorough thyroid workup.
Well, and also some of the blood cancers are picked up on a CBC. So, fatigue can be horrible, horrible things, not just to take an iron supplement.
One of the very early indications of cancer is tired all the time. Yeah. Cancer cells are turning over fast, and they require a lot of metabolic energy, and they will wear people out. So if you are having, I feel run down a lot, I'm really fatigued, and I'm having unintentional weight loss where I dropped 10 pounds I wasn't trying to, when your metabolism is in overdrive to turn over cancer cells, that makes us nervous. If you are having, I'm worn out and I'm having unintentional weight loss, then you absolutely need to see a physician, because we need to just make sure.
And I often refer them until it's proven otherwise.
Yes. And so it's not, if you come in with unintentional weight loss and fatigue and your CBC looks okay, I'm going to ask, are you up to date on all your colon cancer prevention, your breast cancer prevention, all these things? And we're going to make sure you get up to date on those things. But I will frequently send you to our very kind oncologist, hematologist, to just say, make sure I'm not missing something, because it can be the bad stuff. If you're just sitting at home going, well, I'm busy and I'm worn out all the time, it can be the bad stuff like cancer. So get that looked at. Fatigue also, if you're at home and you're feeling tired and run down, one of the things you can do is consider monitoring your sleep. Apple Watches, Fitbits, all of these different health tracking devices are great for looking at whether you potentially are getting a good night's sleep or not. And so that you could present in to say, oh, my Apple Watch says that although I was asleep for 7 hours, I got 4 hours of restorative sleep. Okay, well, now we need to start tracking that this may be more of a sleep issue.
Stress can just make you feel exhausted because you're
in fight or flight. Yeah. Your body is constantly processing stuff and it wears you out. And depression is, many times when people just feel like they're dragging, We can ask a number of different questions and look at other things, and you can feel really fatigued because of other mental things that are going on, whether it's depression or anxiety or grief. And so there's a whole mental health awareness that
Which
we
I will
want
tell
to look at.
patients. I have several patients when I've said, when they complain of fatigue, they'll say, but I'm not depressed, because I think that is kind of what, like, they're worried something is wrong. And so I will tell patients, like, I will work up fatigue all day long, because it could be a million different things. And if we have done the bazillion-dollar workup and I can't find anything, then maybe it is depression, and I still will have patients do depression screenings and the GAD screening, which is general anxiety disorder screening, just for them to have it in front of them, just for them to look. They may not be at all depressed or anxious, but I think it's just kind of a good baseline.
And if you think, well, I do have a number of reasons to be depressed, or I have a history of depression, but I feel like this is different, then I will typically say, well, let's do both. Let's work up the fatigue and let's make sure we're not missing something. Let's get more aggressive about helping you with your mood. And if we help you with your mood and you go, oh, I don't understand, but my energy is better, well, then we don't have to continue down the workup of fatigue.
Yeah.
But if we're helping you with your mood and you're like, well, I'm happy, but worn out, then we've got to keep looking. And I do think, unfortunately, people get put into the depression box and
when
they're like, but I feel like it's bigger than that.
Yeah.
I feel like it's different than that, or I'm not depressed. Then, sit in front of a white coat that's going to listen to you, because the fatigue workup is an easy one to start. And so looking at thyroid disorders, looking at blood disorders and anemia, ruling out the bad stuff such as cancers.
Autoimmune.
Oh my gosh, autoimmune people will feel so fatigued. Oftentimes autoimmune presents with other things, but not always. So if you're also getting a weird rash that comes up at no explanation, that's frequently autoimmune. If you have other autoimmune illnesses, like maybe you're celiac, but this is different. You haven't had gluten contamination, but you're feeling really fatigued. Well, that might make you a person who's at higher risk of other autoimmune. You also have joint pain. You also have muscle pain. Then we definitely want to dig in for look at autoimmune.
And some sexually transmitted diseases as well.
Any kind of infections may make you really fatigued. And every infection isn't I have the flu and I felt so sick with a fever. Some infections are kind of underlying insidious, like mono.
Yeah.
That is an Epstein-Barr infection, and fatigue is one of the primary symptoms. Lyme's disease, chronic Lyme's disease, which is a tick-borne illness that can just kind of, you fight it off a little, but then it just stays there at low levels and rears its ugly head at different times. And that can cause people to feel chronically, like for months, they felt fatigued. But there's a whole infectious approach to rule out any possible infections for fatigue. I think also in looking at fatigue, we want to evaluate the autoimmune, evaluate the infectious causes, evaluate thyroid, blood issues, evaluate mental health. I mean, what could it not be? Evaluate for the bad stuff like cancers. Making sure we're turning over every rock. And many times when you're having fatigue, we really want to look, because it could be just about any system. And so we really want to look at what your other symptoms are. And you may consider bringing a symptom journal. These are the triggers. I notice I feel worse when these things happen first. That's very helpful. Here's the other symptoms I have at the same time I'm fatigued. Or here's the symptoms I have and I might not feel as fatigued that day, but instead now today, all my joints hurt. Yeah. As a postmenopausal woman, I feel like there's not a thing that can't be menopause. But if you are changing in your menses and you're around 50 years old and you're noticing that you're dragging all the time, hormone levels, and a lot of people don't know if they're menopausal because maybe they've had a hysterectomy already. They don't know, they don't bleed. They've had an endometrial ablation. They have an IUD placed. They don't have periods. So they might be 45 and think, well, maybe it's too early.
Yeah.
And so as we cast that broad level of vitamins and anemia and thyroid and other things and
like
blood
asthma
tests.
patients. I mean, I literally can keep thinking like asthma patients when during allergy season, like you'd be like, oh, I'm really, really tired. And it happens to be August and we live in Georgia with all the ragweed.
And I'm congested all the time and I'm not sleeping as good.
Yeah,
And,
like you could
and
literally
I'm not getting as much oxygen. Absolutely. So we're going to ask a ton of questions.
Yes.
The more prepared you come to that visit with maybe a symptom journal, or maybe you've made some notes on what your fitness trackers may be saying at home, that's going to help us hone in one area more than another. I really, typically when someone says fatigue, it becomes, let's ask this question, let's ask this question. And then in our brains, we're going through a differential diagnosis of 50 possible things. And then, oh, not those things, take that off the table. More of these things, let me lean more that direction. For men, fatigue can be low testosterone levels, as we're talking about hormones. And so that could also be part of it. There are things like a celiac disease that is, you're also having a little bit of diarrhea with the fatigue, or there may be other presentation. And if you have something going on in your bowel and it is inflamed, you're not going to absorb all your vitamins and nutrients. So malabsorptive diseases will also make you feel really tired because you're nutrient deficient.
Yeah. And I think sometimes too, when patients come to us, like maybe they've seen it, like maybe they do have a specialist, maybe a cardiologist or a pulmonologist or an allergist, and they've put them on medicines. And we don't necessarily know that because we didn't get the records, or you didn't tell us because you didn't really think about it, or you started a new supplement, or you started something, or you're taking things and it's over the counter and you don't think that much about it, but it might be a side effect of something that you're doing.
Gosh, thank you for saying that.
And so sometimes like people don't want to always tell me everything. They don't want to always be truthful because they're worried I'm going to be upset with them. And I'm like, listen, I mean, I can get upset with you if you would like for me to, so you'll feel bad about it and stop it. But at the same time, like I still need to know, like I still need to be honest.
It doesn't matter because it's an over the counter. So it's Georgia and it's allergy season. So they added back their Claritin and their Benadryl. And then they're like, I just feel horrible all the time. And they didn't realize it was a side effect of their antihistamines, which can be very sedating. Or you got a new medicine and you didn't realize that so many medicines, the side effect of the medicine is fatigue.
Yeah.
And so I'll frequently try to identify around when did you start feeling this, and did you start any new medicines? And sometimes you can be on a medicine for a little bit of time and then it creates a new symptom, especially as we age, because as you get older, your kidneys aren't going to clear the medicine as well. It may end up being a little bit stronger than what it used to be. So you're like, I've been on that medicine for 30 years, but it's a sedating medicine. And so we may be able to pull back the dose some and see if you perk up and get more energy. Yeah. But looking at the medicines you're taking over the counter, supplements and prescriptions, is a common reason that someone can be feeling both sleepy or fatigued. Looking at your lifestyle, did you make major dietary changes and maybe you're running on empty? Did you go, I became a vegan, but you're not supplementing well? And looking at substances,
like
and
alcohol use, nicotine use, those types of things.
Yeah, that makes a huge difference. I started vaping, all these other things, and you, or maybe it's just your stress level. Maybe you're just carrying around, I say just your stress. It's not just, but you're carrying around a lot of stress. There's not anything organically horribly wrong, but we've got to start managing this stress better because it's exhausting you. Yeah. And so truly, what could it be? It could be anything, but here is what I hope, if anyone has a takeaway from this: if your energy is down, do not accept that as normal. There may be a lot of workup that happens to then say, oh, good news, there's nothing profoundly wrong. Let's eat better. Let's rest better. Let's manage our stress better. And let's see if you feel better. Or there could be something profoundly wrong and you don't want to just be at home going, well, I'm a mom who works full time, who is pulled in a million directions, who also takes care of my parents. So of course I'm tired. And maybe it is, of course I'm tired. Let's at least do your preliminary blood work and make sure everything looks okay, because we don't want to miss it if there is something significant going on. Yes. All right. So if you're tired, come talk to us, and we'll be ready to be busy because we're all tired. Yeah. Thank you so much for joining us today. We like to leave you on a good note. So today's Tell Me Something Good is a smile. Have you ever smiled at a stranger and they smile back? You don't know this person, they don't know you, but it is a common language of kindness. Give somebody a smile today. It will be something good. Thank you for joining us, and until next time, take care of yourself.